please.
Okay, thank you for the introduction. And hello, everyone. And it's my pleasure to be here to share our multi-centric experience on the thyroid artery embolization for goiter. Okay, thyroid artery embolization has been reported in small series, but it was applied at first for the grave disease. And interestingly, in addition to controlled hyperthyroidism, those studies also found there is a significant reduction of the thyroid size after embolization. So the following study tried to investigate the use of thyroid artery embolization in treatment the thyroid goiter. However, there was no consensus on the thyroid artery embolization protocol and the choice of embolic agent. So we designed this retrospective study, try to investigate if the embolization protocol and the choice of embolic agent will change the effect of embolization. So this is a retrospective study. We include case done at the Keelung and Kaohsiung Chang'e Memorial Hospital, and in the period from April 2021 to April 2025. And the inclusion criteria, of course, patient receives thyroid artery embolization for the benign goiter, and with available 6-month imaging follow-up. And we exclude the patient with incomplete imaging or follow-up data, and we exclude the patient with previous thyroid surgery or radio frequency ablation, and also technical failure. And we analyze the embolization protocol, embolic material, and the embolization efficacy. The primary endpoint would be the volume reduction rate at the 6 months of the dominant side of the lobe or the dominant nodule. So 41 TAE for goiter was done in these 2 centers, and 3 cases was excluded. 2 was excluded because of the procedure failure, and 1 was excluded because the patient received embolization for recurrent goiter after subtotal thyroidectomy. And total 38 cases were include 37 female and 1 male, aged between the 29-year-old to 88-year-old. And here's the overall data. The average pretreatment volume of the dominant side of the dominant nodule would be 130 milliliter. And at 6 months, the nodule reduced to 41.3 milliliter, corresponding to the volume reduction rate, average volume reduction rate at 68.2%. And the median volume reduction rate was 72.5%. The result is similar to the previous study. However, we found there is quite high on the standard deviation that indicate there are great inter-patient variability in the treatment response. So first, we analyze if the baseline volume is related to the treatment response. Although there's an inverse trend, but actually there was no significant. So the baseline volume was not included the treatment response. And next, we analyze the embolization protocol. The embolization protocol was not uniform in these 2 centers, but we categorized into 3 categories: the bilateral embolization, the unilateral embolization, and single vessel embolization. So on the bilateral embolization, it's typically applied for the nodule, for the goiter, for the patient with diffuse goiter. And typically, it's embolized in bilateral superior thyroid artery and one of the inferior thyroid artery. We will spare the other inferior thyroid artery to avoid the damage of parathyroid gland. So here is example. 67-year-old female. She has a diffuse goiter, bilateral lobe. So we embolize bilateral superior thyroid artery and right inferior thyroid artery with 500 micron embolizing and coil. At 6 months follow-up, we can find there is a 83% volume reduction of the right lobe and also marked regression of the trachea compression. Here's a coronal view of the imaging. We can see the marked reduction of the right lobe thyroid. The next category would be the unilateral embolization, and it's typically applied for patients with unilateral disease only or dominant nodule in one lobe only. And typically, unilateral superior thyroid artery and the ipsilateral inferior thyroid artery was embolized. The next one would be less common. It's a single vessel embolization. Single vessel embolization is not common in thyroid artery embolization because we tended to thought it was ineffective because there was abundant collateral and in arterial to arterial anastomosis inside the thyroid gland. But in our series, we found 5 cases with only one dominant feeder, and all the 5 cases seems like to be an esophagic pedunculated nodule bulging from the thyroid gland with single feeder. So here is one case. It's an 80-year-old female with large left inferior thyroid nodule with a feeder only from the left superior thyroid artery. So we do the embolization with 700 micron embolizing and coil. And during the 6 months follow-up, we found there is a 61.4 volume reduction in this case. And on the chest X-ray, we can find there is a regression of the trachea deviation. And here's another case, the only one male case in this series, an 80-year-old male. He had a right inferior thyroid nodule, also esophageal nodule with single feeder from right inferior thyroid artery. And this one is embolized with 300 to 500 micron embosphere and coil. Unfortunately, 2 months later, the patient developed fever and right neck bulging. And he went to the ER, and the CT down there showed there is a thyroid abscess. Fortunately, the patient received conservative treatment and percutaneous drainage and recovered well. During the 6 months follow-up, there was the 95% volume reduction. So although there is different type of thyroid embolization protocol, and overall there are no significant difference on the treatment effect. Finally, we analyzed the embolic material. All these patients were embolized with microspheres. 27 patients treated with 300 to 500 embospheres, and 3 patients treated with 500 embolizing, and the other 8 cases treated with 700 embolizing. Most of the case, coil was applied. So if you comparison the embolic agent size with the outcome, and we categorize the patient into 2 groups. The one group is the microsphere less or equal to 500 micron, and another group would be the particle size up to 700 micron. And the pretreatment volume, there was no significant difference. But on the volume reduction rate, obviously a small particle size have a better volume reduction rate. In 500 group, there was 72.5% volume reduction, but there was only 52.1 volume reduction on the 700 group. If we further analyze the median volume reduction rate at 6 months, the result is similar. And the 6 months median volume reduction rate on the less than 500 group would be 78.6%, but it's only 47.6% on the 700 micron group. And if you use the overall median size reduction rate, 72.5% as a cutoff value to define the responder. And we found that less than 500 group, there was 60% of the patient have response to the treatment. But in the 700 micron group, there was only 12%. So in conclusion, thyroid artery embolization is effective procedure for nodular goiter with average volume reduction rate up to 68.2%. And the pretreatment size was not correlated with the volume reduction rate. And for the embolization protocol, we should apply different embolization protocol according to the patient's disease pattern. And it seems there was no difference on the volume reduction rate between the different protocols. But the small size of the embolizer brings greater goiter reduction. And here is my presentation. Thank you for your attention.